The Nigeria Customs Service said it intercepted 11 containers carrying unregistered sex drugs, expired foodstuffs, and other contraband worth 921 billion naira at Apapa ports between January until date. Ayo Olayinka has lamented that several couples are battling with infertility, noting that 3 out of 10 couples deal with one form of infertility or the other. Good day, listeners. Welcome to DDM Health News Update today on our program, Your Health, Your Wealth. As usual, listeners, I often remind you guys to subscribe to our YouTube channel, Dashra Digital Media, so as to get the latest on health. So listen carefully to get the latest. A fertility consultant for BridgeClinic Lagos, Dr. Ayo Olayinka, has lamented that several couples are battling with infertility, noting that 3 out of 10 couples deal with one form of infertility or the other. Olayinka spoke during the April edition of the BridgeClinic Forum themed Navigating Fertility Challenges as a Young Person, held in Ikeja, Lagos. Describing a 30% ratio of infertility as something to worry about, he urged Nigerians to do away with the predisposing factors to infertility. He warned that smoking, alcohol consumption, being overweight, underweight, and malnutrition are harmful to fertility. Yes, malnourishment is harmful both to men and women. Furthermore, he stressed that the numbers could even be more as infertility is largely underreported, adding that couples take infertility as individual and not a community or government problem, which is true. Going by data, it's safe to say that as many as 3 in 10 couples are dealing with one form of infertility or the other. That tells you that as many as 30% of couples have an issue. Wow, that's a very large percentage. In places like Nigeria, why that may not be one of the issues on the front burner is because we have a large population. By the time you compare one population to the resources available to us, in fact, international organizations like WHO are even saying that we need to reduce the number of kids we are giving birth to. But how possible is that? Well, you can't tell. Speaking further, he cautioned against the notion that seeking fertility solutions is only for the rich, though that's what people say often. He refers that governments can reduce the cost of in vitro fertilization through partnership with insurance companies and other relevant bodies, non-governmental organizations, and the rest. Most of the people that access our advanced fertility solutions are not people you will categorize as rich, but they are people who have a desire, which is to achieve conception, to have a child, they want to become parents. That is the unified. Our status, whether you are rich or poor, is irrelevant. Once there is a burning desire to achieve conception, we strive to find solutions to it, which is the point. That's facts and never fiction. You will find out that at the end of the day, a man can only put his resources where things hold him. What he desires the most. Yes, IVF is price zero, but the prices is in the last 10 years have come down because we have more centers that offer this infertility solution or this fertility solution. So that what has happened is that there is an increase in supply. Once there is an increase in supply, price drops as long as the demand remains constant. Or written about it. Olayinka also urged religious leaders to encourage their followers to seek medical solutions to their fertility issues. He cautioned religious leaders against the narrative of prayers replacing medical intervention. Rather than prayers should be seen as complementary to science. I think religious leaders will have to do a lot in terms of talking to their congregation. Yes, there's a role for God, but God is not going to come down. Don't you see? He's going to use people to solve the problems. If you don't seek medical help, how will you get the problem solved? So if you're sick, go to the hospital. While you are in the hospital, prayers can always be provided to support and help the doctors to provide the right kind of medication or treatment. And I think that is the way people should begin to look at religion and prayers. It should be seen as complementary, not as a replacement for the actual science, which is medical intervention. So please, don't take prayers in place of medical intervention. Try to seek medical advice. Next, as Nigerians workers join millions around the globe to commemorate International Workers' Day on May 1st, 2025 today, the Nigerian Medical Association Lagos State chapter has called for improved welfare packages for doctors and other healthcare workers to the country to curb Japa syndrome. Everybody done the job. Wow. The association warned that if the government at all levels fails to address the root causes of this migration, the survival of the health sector could be in jeopardy. In an exclusive interview on social media, the Lagos NEMA chairman, Dr. Babajide Saheed, outlined a list of demands in line with stemming the tide of the exodus of medical professionals and boosting morale in the health sectors. Saheed noted that any health reform that failed to address the challenge of human resource flight would be ineffective. Any policy of government which doesn't first resolve the issue of Japa syndrome is a waste of time. Such policies will not work without the driving force of the human resources. Oh, don't you think so? Wow. Well, DDM Healthwise reports that 16,000 doctors have left the country in the past 7 years. Oh my goodness, 16,000. According to the coordinating Minister of Health and Social Welfare, Professor Ali Pate, the country is left with 55,000 doctors and a doctor-to-patient ratio of 3.9 per 10,000 naira. All our doctors have even left. Other healthcare professionals such as nurses, laboratory scientists, and physiotherapists have also emigrated to greener pastures, with the United Kingdom, Canada, and United States of America as the choicest destinations. Poor remuneration, lack of equipment and facilities, and the economic and insecurity situation in the country are some of the reasons for the mass migration of health workers. Yes, you can imagine after studying in school, what you get paid off is just a token. Continually, Saheed stated that to tackle the Japa syndrome, both federal and state governments should immediately implement non-taxable call duty allowances and introduce improved welfare package for healthcare workers. The doctor said better remuneration in terms of non-taxable call duty allowances, increase in professional allowances according to the national inflation rates. Better and sustainable welfare packages such as affordable housing loans and mortgages, affordable car loans, better and conducive health sector environment through training and retraining, research grants, better equipment and materials, better infrastructural development, good health sector policies that will enhance efficiency, productivity, and effectiveness with empathy and respect, which would be inclusive. Any policy of government which doesn't first resolve the issue of Japa syndrome is a waste of time. Such policy will not work without the driving force of the human resources. I believe that too. Other demands include the immediate payment of skipping areas and reviewed consolidated medical salary structure areas, better health infrastructure, consistent training, research grants, and a more inclusive policy framework that promotes empathy and respect in healthcare delivery. The NEMA also requested the harmonization of the salary structure of medical doctors in academic institutions with the comments and the stoppage of casual appointments for doctors. He said, Implementation of increment in retirement age of healthcare workers, consequential readjustment of professional allowances of doctors in relation to the increased minimum wage. Okay? Conversion of medical lecturers and medical doctors in the university, medical health centers, polytechnic to conmen salary structure and stoppage of locum appointments for doctors. That is the casualization. No be small thing. Speaking to on pending issue, the Lagos NEMA chair called on the federal government to fulfill its promise by paying the revealed conmess areas pledge since last year. Oh my goodness. So sad. Sahid also called for an upward review of the retirement age for healthcare workers and an adjustment of doctors' allowance based on the proposed new national minimum wage. He further demanded the withdrawal of the consultant pharmacist cadre in clinical settings, citing potential disruption in patient care and lack of clinical value. But looking at it in the other way around, as when doctors are not getting their things, why won't they japa? Definitely, they will. Everybody's looking for a greener pastures. Up next, or rather, finally, the Nigeria Customs Service said it's intercepted 11 containers carrying unregistered sex drugs, expired foodstuffs, and other contraband worth 921 billion naira at Apapa ports between January until date. Addressing journalists while showcasing the seized containers in Apapa on Wednesday, the Comptroller General of Customs, Adewale Adeniyi, stated that the 11 containers comprise 5 40-foot containers, 2 20-foot containers, and 4 additional seizures of loosely concealed contraband items with a total duty paid value of 921 billion naira. He explained that out of the 11 seized containers, 5 were carrying sex enhancement drugs, adding that the items constituted a clear danger to public health with the potential to cause significant mortality if permitted to infiltrate the domestic markets. Giving details of the seizures, the CGC explained that the first 40-foot container had 89 cartons of unregistered pharmaceutical products, while the second 40-foot container carried 242 cartons of unregistered pharmaceutical products. The third 40-foot container had 1,001 cartons and package of hydrosildenafil citrate tablets. These are also lacking requisite NAFDAC registration. Oh my goodness. You can imagine. People are so heartless and wicked at the same time. Also speaking, other packages contains chest and lungs beta plus big bolted tablets, also unregistered. The fifth container contained 805 packages of unregistered products. This was falsely declared as cosmetic powder. Then, we also have a 20-footer container which has expired migraine products. Oh my goodness. You can imagine. Migraine, expired one for that matter. With 60 units of warrior drones. These are things that people carry out in order to sell in the name of making money. God. Also, Adeniyi emphasized that the intercepted drones loaded in one of the containers with a duty-paid value of 15.9 billion lacked the end-user certificate from the Office of the National Security Advisor. We also intercepted another 53 units of different helicopter drones. These drones were intercepted for lack of end-user certificate, and it has a duty-paid value of 2.1 million naira. We have 10 pieces of professional FM transceiver, that is transceiver walker-talker. These are communication devices evacuated for lack of end-user certificates, he added. Adeniyi warned that the disturbing trend in the importation of unregulated sexual performance drugs poses serious health risks, including potential cardiovascular complications and harmful drug interactions when used without proper medication supervision. According to him, all the items fall into 3 different categories, adding that the first category, which constitutes 73.7% of the total seizure, is that of unregistered pharmaceutical products, lacking mandatory National Agency for Food and Drugs Administration and Control registration numbers and certification. Which is a direct confirmation of Section 28 of NAFDAC Act, Cap N1, laws of the Federation, and this constitutes 63.7% of the total seizures that we have today, more than half of them. You can imagine. He mentioned that the second category is expired food items with compromised safety profiles that pose an imminent danger of public health if introduced into the consumer market in violation of the Food Products Registrations and Regulations, and also Pre-Shipment Inspection of Exports Acts. Adeneyi highlighted that the third category is that of controlled equipment, including drone technology and telecommunications devices, imported without the requisite end-user certifications. Also, without the certificate from the Office of the National Security Advisor. He raised the alarm over that what he described as a sophisticated pattern of wrong declaration, where importers deliberately classify pharmaceuticals as general, mechanized, or cosmetics. Adeneyi stressed that 2 containers had these pharmaceuticals, but were concealed with skin creams to hide them away from customers. He stated that the seizure revealed that importers are diversifying their contraband portfolios, combining pharmaceuticals, food items, and control technology in systematic shipments. Adeneyi said that the development suggests the emergence of organized networks with sophisticated capabilities rather than isolated smuggling attempts that we should have today. He, however, said that in terms of inter-agency collaboration, the service was working with critical regulatory agencies, including, but not limited to NAFDAC, the National Drug Law Enforcement Agency, and the Office of the National Security Advisors. This collaboration operates under establishments, memoranda of understanding, and joint operational frameworks that have demonstratively enhanced our enforcement capacities. As documented in our joint operational report of January 2025, the nexus between unregistered pharmaceuticals, controlled substances, and national security infrastructures continues to present a multidimensional threat matrix to our sovereignty. Also speaking, the Director of Port Inspection at NAFDAC, Dr. Olakunle Olaniran, confirmed that some of the seized drugs carried fake registration numbers and posed serious health risks to unsuspecting Nigerians. He said, one of the confiscated products was intended to industrial use in cow treatment, but was fraudulently branded with a NAFDAC registration numbers originally issued for another product, which is the widely known pain medication, tramadol. He said another intercepted product was falsely marketed as a mental health medication, but lacked a legitimate pharmaceutical identification. You can imagine what people are going through. People sell things in order to make money and forgetting the risks of all these things. Well, we will survive. So, as we go further, viewers, I think this should be the end of today's discussion on your health, your wealth. Do not forget to like, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media. And don't forget to drop your comments. What are your suggestions to all these challenges we are having here in Nigeria? Until I come your way next time, I remain Nenyo Michaeline Ezine. Thanks for watching. Bye for now.